Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. And today I'm going to be starting the mini-series around how to choose a therapist for looking into helping treat dissociation. And in the first of these videos, we're going to be looking at the psychiatrist and just giving an overview on the background, training, qualifications, what you might expect that a psychiatrist will be able to offer, and a little bit of sort of a broader deep dive into sort of how different psychiatrists approach dissociation in slightly different ways. And then what we'll do is we'll come on to, within the rest of the series, we'll look at all of the other different types of therapists so that we're not making one huge video, we're making videos that are a little bit more watchable as we go along. To begin with, I want to make it clear that what I'm not talking here is about any one type of therapist is better quality or is going to be better for you than any other type of therapist. The personal nature of being a therapist is ultimately going to be what counts, but it's really important when someone's looking for a therapist that they're able to understand what the title or the profession and the qualifications of each therapist actually mean. So this doesn't mean that I'm talking about the quality of the therapist, because that's really an intrinsic feature, and many therapists, like in any job, in any profession in the world, there's going to be some that are really good and there's some that really are not. And and this is about how you find this stuff out. But the most important thing is that there's an understanding of what the titles mean, so that if you're looking for someone to help assess or diagnose or treat with a dissociative condition, that you have an understanding of the sort of background and qualifications that any person might have, and also how you can be protected and what rights you have and things like that if anything goes wrong, because also that's incredibly important. And the list is not in any particular order, but it just goes through some of the most common sorts of therapists that you might encounter, or when you're doing searches on the internet trying to find out or looking at professional registers and where to go for these things. So in terms of how you actually find people, sometimes it's about just what's in your local area. You might put in therapist in the town and the city that you live, or you might go to a professional register. So for example, like the British Psychological Society has a register of therapists. The International Society for the Study of Trauma and Dissociation has a register of therapists. So there are ways to being able to try and find people, and then through that register you can look for descriptors about the sort of background and experience that a person might have, specifically looking at dissociation. Because realistically, we're looking at specialist areas here. So while there are many different types of therapists, and there may be many that do know about dissociation, my feeling is that the majority won't. It's not really standard on training courses for any of these. So the reliance on whether or not the therapist is going to be good at dissociation will come down to not just their qualification or their job title, but the sort of experience they've picked up, the knowledge, the skills, the training that they've done along the way. And there are some fairly straightforward things to look out for and things to be very wary of, and we'll get into that as we start looking through this list. To begin with then, I'll start with the one that is sort of probably most commonly misunderstood in some respect, which is the psychiatrist. So these are often consultant psychiatrists or just psychiatrists. So what sets them apart from everybody else is that these are primarily medical doctors first, who have then trained and specialised in psychiatry. So they're all medical trained doctors. So when they call themselves doctor this or doctor that, they are genuinely medical doctors with a professional medical degree qualification behind them. And they are therefore held to account by a Royal College of Psychiatrists, as will be in the United Kingdom, and they are bound by a code of ethics and a series of conducts that they have to perform and live up to a very high standard for how they practice. Sometimes psychiatrists will be in national health services like the NHS in the UK, or they might be working for insurance companies, or they're in private independent practice. And that's true for most therapists. So some might be assigned to you through a service that you've come into, or by an insurance company, or you sort them out online. And just because a person is a psychiatrist does not necessarily mean that they are going to be any good at the therapeutic stuff, although many psychiatrists have undertaken external and additional training in psychotherapeutic techniques. And for myself, I've often been asked by psychiatrists to offer some training, and I have done in the past, and I've given them like 6-month placements in psychotherapy. So there's a lot of psychiatrists out there that are not just interested in the medical view of any mental health condition, such as dissociation, but they're also really interested in the psychotherapeutic aspects of that, i.e. the therapies of it. What also sets psychiatrists apart from most of the other types of therapists is that they can prescribe medication. So going and seeing a psychiatrist for a dissociative condition might end up in having some medication prescribed, might not. It just depends on exactly how they feel, but they are actually licensed and registered to prescribe medication, unlike any of the others, unless, for example, the psychologists have undertaken an additional very high level of training in order to do that, but very, very few will actually do that. So generally speaking, go to a psychiatrist and they are trained, they are diagnosticians first and foremost. So part of their role is to diagnose mental health conditions and treat accordingly, and they are often held or they often work within a biopsychosocial model, which means that they are very interested in the medical aspects of mental health conditions, i.e. the biology, the neurology of the brain, and they treat and often they work accordingly. Again, some are very psychotherapeutic. For example, some have done psychoanalytic training. So there'll be psychoanalytic psychiatrists who have gone additional many years of training and experience in looking at mental health conditions with a view to using psychoanalytic or psychodynamic methods for treatment. So just because a person that you might go and see as a psychiatrist does not mean they can't do therapy, but it's about checking out to see whether they do or whether they do not. If you're interested in understanding about the ethics and the code of conduct, all psychiatrists within the United Kingdom are bound by the Healthcare Professions Council, also known as the HCPC, and therefore they will be on a register for this. I'm going to put up a picture of the register for the HCPC, which means you can search the name of the psychiatrist and to see whether or not they're on that register. They should be, and that means that they are bound by the code of ethics set out through UK law about practicing and prescribing or any of that kind of stuff as a psychiatrist. That also gives you protections because you know that they're bound by that code of ethics. So if anything goes wrong, you can contact the HCPC independently, you can seek advice, and if necessary, you can make a complaint. And all psychiatrists have to abide by the terms and conditions set out by the HCPC in order to practice in the United Kingdom. Psychiatrists elsewhere in other countries will also be bound by code of ethics of local or countrywide licensing standards. So the level at which a psychiatrist is bound to work is set at a very high standard. This does not mean that the psychiatrist is going to be any good at what they do in terms of their manner and how they come across, but their professional qualification sets that standard for them. So a psychiatrist is probably going to be unlikely to be the sort of person that would end up doing long-term psychotherapy for a dissociative condition, but some do. So not to discount them entirely, but a lot of people with dissociative conditions will have met a psychiatrist along the way and had either good, bad or indifferent experiences, and at least you understand exactly what the role of the psychiatrist is. Obviously, there's a whole ton of stuff about psychiatry out there which you can search yourself, but that's the first point of call for a lot of people when they're referred into mental health systems. Okay, so that's the first part of this, is really just the overview on what psychiatry is. So because that's someone that most people are likely to meet, as I've said, and it's important to know exactly what a psychiatrist is likely to offer and provide, and how they're limited and how they're bound by the code of conduct of their framework. So on the next video, we'll start looking a little bit more about the ones that are much more likely to be able to actually offer longer term therapies, such as the psychologist and the psychotherapists, and I'll put that together in the next video. It was simply too much to put everything in one video, so I'm going to segment it out a little bit, just to allow to really get into a bit more detail about each and every one of these. So thanks ever so much for watching this one. Please continue with your comments and thoughts and any questions that you might have about this whole topic of how to try and find a therapist for dissociation, and we'll keep the videos coming for you. So between now and the next video, please do take great care.